Hi there, I'm Dr. Tang. I'm one of the senior vascular surgeons from the Vascular and Endovascular Clinic from Gleneagles Hospital in Singapore. This afternoon, welcome to Dr. & Co, where we will connect patients and specialists together through conversations about their medical conditions. For today's discussion, we shall be talking about varicose veins and chronic venous insufficiency. This is a very common problem, but it's poorly understood and not well treated. Today with me is my patient Shereen. Shereen, good afternoon.
Hi.
Please tell us more about yourself and what you do.
Yeah, so hi, I'm Shereen. I'm 26 years old and I'm a postgraduate student.
So tell us, when you first came to me, what symptoms were you developing?
Yeah, so because of my schoolwork, I'm having to stand for really long hours in a day, and I would find myself at the end of the day feeling really heavy and having these really bad cramps at my calves. And I guess the tipping point for me was when I started experiencing wounds that would form without any reasons.
And were they taking a long time to heal?
They were. I think the one that I had took almost 2 weeks, and that was when I started thinking, okay, something's wrong.
Thank you. Varicose veins are abnormal dilated veins on the legs. They only occur on the legs. These are the lumpy, twisty veins that you see on the surface and that look like blue or red and purplish and can get worse over a period of time. They can cause symptoms such as heaviness, swelling, cramps, typically at nighttime, and can actually affect people's walking and their quality of life. It is a progressive condition. It is a medical condition and not just cosmetic. It can be disfiguring, but actually it is progressive and causes medical problems.
Okay, so actually, who are at risk for getting these varicose veins?
It's a very good question. Varicose veins actually can affect anyone at any age, but typically, normally after about 30, normally it affects females more than females in a ratio to 4:1, especially after pregnancy. Those people who are predisposed to standing up for a long time, such as those working in the restaurants, in business, those who are doctors, nurses, architects. These are the people that are prone to basically having high pressure in their veins, and gravity is never our friend in these kind of scenarios. I've treated patients all the way from 14 all the way over to 90, so it can affect anyone at any age. So Shereen, do you remember what tests I did for you when you first came to see me before I did any procedure?
Yeah, so I recalled you doing an ultrasound scan to see if my veins are truly refluxing. Yeah.
So that's basically what you need: a good physical examination, a good history, and then an ultrasound scan to confirm the diagnosis. So the ultrasound scan is just a probe with some jelly. It is not invasive. It can take half an hour quickly to do. And what it looks at is the size of the vein, where the faulty veins are exactly, the severity, and also how it communicates with the deep system. The deep vein is the one that's responsible for deep vein thrombosis. And you want to look at that to see whether if you deal with the veins on the surface, are you going to affect the veins lower down or deeper down? So Shereen, please share with us your experience when you had your procedure done recently.
Yeah, so the day of the surgery, I went to day surgery. I spoke to the anesthetist and she talked to me about the different types of anesthesia there is, and I was under regular sedation. So I think the entire operation was just under an hour, and after that I woke up from sedation, had some coffee and biscuits, and then within 2 hours I was back on my feet. I went to the market to eat lunch with my family, so I was fine. Like, I was walking fine. I had bandages after the operation, but I was still able to move around. Yeah.
So how was the pain? Was there any pain at all?
None at all. I was kind of surprised as well because I was expecting to feel a little bit sore after the surgery, but I did not feel any pain, and I just had the bandages on my legs so I could feel them as I was walking, but it didn't stop me from walking. I could still walk fine, and yeah.
Did you have to have any stitches taken out at all?
None. Yeah. Within the next 2 days, I just removed the bandages on my own and I was back at work again.
So this procedure just basically involves a pinprick, less than 1/4 of an inch in size, and they just heal by themselves. And normally you get a very good response to the treatment with minimal pain, and patients are back on their feet the same day and can go back to their normal daily activities. And the fastest I've had a patient go back to work the very same day. So Shereen, just tell us more. What did I exactly do for you to treat your varicose veins?
Yeah, so if I'm not wrong, I think it was the Mechanochemical Ablation, or MOCA for short.
So MOCA, nothing to do with coffee. Actually, it stands for Mechanical Chemical Ablation. This is one of the newer non-invasive techniques that patients often seek. What it is literally a gun and a catheter that fixes together. And what happens is that it spins inside like a washing machine inside your vein to abrade the vein. And by blocking the vein after that, and then you're adding sclerosant, where I'm pressing down onto it, and you can see it coming out, and you just move inside the vein all the way back to the entrance, and the vein is blocked almost instantaneously. And all you're left with is 1/4 of an inch of an incision on your skin, which will heal by itself. This is one of the newer techniques. There are other new techniques which doesn't use any heat, and things like glue has become a very popular procedure for varicose veins as well. Can you just tell us a bit, Shereen, why did you decide, obviously with informed consent, I had to tell you the different options. Why did you decide against glue?
Yeah, so I heard with glue, the recovery time is slightly longer and there's a risk of inflammation, and the idea of having, a foreign object or foreign substance inside my vessels didn't really sit very well with me.
There are other techniques which are much more tested, like radio frequency ablation, laser, and even microwave now. People are microwaving their veins to block these veins, but they include having heat and multiple stick injuries, because we have to put local anesthetic around the vein along its full course. So MOCA, the whole procedure can theoretically be done through one tiny incision that will heal by itself very quickly.
Right. Dr. Tang, how can I prevent this from coming back again?
That's a great question, Shereen. Often asked by a lot of patients after their surgery. Whatever you do and however well the procedure has gone, there is always a risk of recurrence. The body, in response of these faulty veins being blocked off, will form new veins in the body and on the leg. Things that you can try to do is have a healthy diet, such as having a high amount of omega oil from salmon, from fish, cod liver oil supplements, having flavonoids from the berries, from strawberries, from raspberries, and also getting regular exercise. Prolonged sitting, prolonged standing doesn't really make a difference. Gravity is always there, and it's never your friend, as I previously said. Shereen, thank you very much today for sharing your story and your experience following your MOCA procedure.
Well, thanks for having me, and thanks for sorting out my veins.
You're absolutely welcome. And thank you all for joining us. I hope you've learnt about varicose veins, how simple it can be to boost your leg and vein health. If you've got any concerns about any faulty veins, please don't hesitate to come and find us at the Vascular and Endovascular Clinic at Gleneagles Hospital, where we're very happy to help.
And for more information like this, be sure to subscribe to Medical Channel Asia. Thank you.
Thank you, and goodbye.